And we are back. Elder abuse has become a growing concern, both as a public health issue and a human rights violation. Research shows that 1 in 10 Americans aged 60 and older experienced some form of abuse before the COVID-19 pandemic, with that number rising to 1 in 5 during the pandemic. The New York City Department of Aging is working tirelessly with community partners, helping to eliminate ageism and ensuring that older adults, regardless of their immigration status, have access to safety, resources, and justice. Joining me now is the Senior Director of Elder Justice at the New York City Department for the Aging, Molly Bernstein, and the Chief Program Officer of Neighborhood SHOPP, Tynisha Rodriguez. And thank you both for joining us.
Thank you so much for having us.
Thank you. And first, I'll start with you, Molly. As I said in the intro, the numbers are continuing to rise. But from your perspective, what are you seeing with firsthand experience?
Yeah, well, you're exactly right, Darren. To your point, we did see that, especially early on in the COVID-19 pandemic, there was a sharp increase in the rates of elder mistreatment that we saw. Those rates have come down slightly, but they are still higher than before the COVID-19 pandemic. And so what we know is that there are older adults out there who need services, who can benefit from additional support. And we are committed at NYC Aging to making sure that we answer that call. So we have multiple programs here to support older adults who are impacted by crime and abuse, including our network of elder justice community providers. I'm joined today by a representative from one of them. And so we know that this is urgent and critical work, and we at NYC Aging are committed to answering that call.
Yeah, Tanisha, I want you to introduce yourself through letting us know a little bit about Community SHOPP and the work that you're doing to help with those who are in the aging community.
So, Neighborhood Self-Help by Older Persons Project, we have been an innovative multi-service organization serving the Bronx for 45 years. We have been a pillar in even serving elder justice since 1995, and we really take great strides in how much we have protected this vulnerable population from elder abuse. But SHOPP has 12 different core programming to support not only those who have been abused, but to support caregivers, older adults with socialization, along with any age of anyone with a disability.
Yeah. Can you give me an idea as to trends that you might be seeing these days? Because as we look about, in COVID, there were certain things that I know pretty much you saw a lot of. Now that we're kind of out of that area, what are you seeing now?
So the trends that we're finding is, especially post-pandemic, are individuals who are highly dependent on the abuser financially, especially with the way the economy is, and a lot of individuals who are being subjected to abuse, their fear of even reporting based on housing instability. So that really has been a great trend throughout the years for us in terms of exploitation of this vulnerable population.
Yeah. Molly, as we talk about things that are going on right now, obviously across New York City, a lot of effort is being paid to take care of this most vulnerable population. From your perspective, talk to us about a little bit about technology, because we moved into this technological phase since COVID. How is technology playing a part in what we're doing in terms of dealing with those who are aging? And particularly given the fact that, we talk about isolation, right? And isolation is pretty huge.
Yeah, absolutely. So, I think that all of us, NYC Aging included, in the early days of the pandemic, we had to figure out ways to pivot. And we had to figure out ways to continue to provide services for older adults, even though some of the typical day-to-day activities that we all may have participated in pre-pandemic were really disrupted. Things like being able to leave the house and go to an older adult center or attend a medical appointment. And so one of the benefits that came out of that was, a lot of work and resources and thought was put behind how to deliver services virtually, right? How to bring services to the older adults wherever they were, be that in their homes, in their communities, or elsewhere. And so we were able to successfully do that during COVID-19 and ensure that there was as minimal disruption to services as possible. But we also know that sometimes older adults may not be quite as comfortable using various technologies. And so there is a digital divide that we need to think about as well. And so where we've sort of landed now is we try to have sort of a hybrid approach to our services where we provide virtual services or over the phone services to older adults who want that, but we're still providing those in-person services as well in order to make sure that folks are able to really stay connected and active in their communities.
Yeah. Uh, Tanisha, when you think about the work that's going on that you're putting with neighborhood SHOPP and you're talking about those who are in the aging community, I want to ask this question about the power of like collaboration because, you know, in order to get some of these things done across the finish line, you know, collaboration is huge. And I'm going to ask you, you know, tell us about some of the collaborations that you have that have really been able to make a difference in the lives of some of these people that you're serving.
Well, here at SHOP, educating the community on elder abuse is crucial, right? Having this program that's so vital that detects the that not only can detect the abuse but also prevent it and respond to the abuse. We take great stride in bringing community awareness on signs of elder abuse, even if it's just an elder abuse 101 training, not only to older adults but to professionals. We actually have an initiative going on right now where we are educating the faith-based community on elder abuse because we believe it takes a village, and educating the community is vital. It not only empowers older adults to be kept informed, but also it gives a great demand for more services the more you keep hearing about it. So outreach to the community, to a wider community, really is essential for this vital program.
Yeah. Financial exploitation is huge when it comes to those who are being, you know, those who are dealing in this vulnerable population. How are you taking some proactive steps in really educating and then also helping out in this area that is so prevalent amongst those who are aging?
Well, elder justice is about dignity, autonomy, and safety, right? And when it comes to financial exploitation, um, we, as in SHOP, how we provide services to a vulnerable senior would be we look at what stage the person is at, right? Are they reluctant to services? They may deny the allegations, but through supportive counseling, we really, try to educate the individual and say you do not have to subject yourself to this. And although you may be relying financially, on this individual, but through supportive counseling, our team really has been great with providing the tools to getting the individual to then become and recognize that I don't have to continue to live this way. And then we work on the rebuilding stage, right? Whether we need to go the route of getting an order of protection, how do we get the person to vacate the home? There are a lot of opportunity to help the individual. It is a very challenging position to be in to even help the individual because there are a lot of barriers to services, right? But we're talking about a vulnerable population that is so underreported because of the fear, the shame, the guilt. So even coming across any referral for someone being financially exploited, it takes time to engage that individual. And we're here to be patient and work with that individual to empower them to become resilient because ultimately that's what SHOP is about.
Yeah. Molly, for a moment, take some time and share with us this perspective. I want to shift gears a little bit because we talk about, you know, policy. Policy's huge. We know that in Albany right now they're discussing cuts that are needing to be made, and many times those fall in the vulnerable populations. But when we talk about policy reforms and things that we should be paying attention to, what are some of the things that the public should be having their eyes and their ears on?
Yeah, it's a great question. I think to Tanisha's point, elder abuse is such a complex issue, and a lot of times folks really don't understand or aren't aware of how prevalent it is. Right. So elder abuse happens in all of our communities far more often than we realize. Just last year alone, we had over 3,000 people access services through New York City Aging's Elder Justice community providers and through our Elderly Crime Victim Resource Center program. And so we know that there is a huge need out there, and we know that there are more older adults who can benefit from these services that we're not yet reaching. And so any sort of policies that really pull more people and pull more resources into the conversation and broaden the sort of scope of folks talking about and thinking about how to address these issues in our communities are going to be of huge benefit and of really vital importance to combating elder abuse in our communities.
Yeah. I want to talk about the data right now because it shows that, the numbers in elder mistreatment went up during COVID-19. And are we continuing to see this kind of uptick given the fact that so many people are still dealing with isolation?
Yeah, we are. So, you're exactly right that in the early days of the pandemic, we saw the rates of elder abuse and elder mistreatment increase drastically. There are some reports and some data to suggest that it went from 1 in 10 older adults experiencing elder mistreatment to 1 in 5. It does seem, based off of the data, like those rates have come down from the earliest days of the pandemic, but they are still higher than what we were seeing pre-pandemic. And there's a lot of reasons for that, right? Social isolation, to your point, Daren, is a huge factor, right? Older adults are not getting out into their communities as much. They're not interacting as much in their day-to-day lives. Things like attending medical appointments, visiting an older adult center, interacting with a bank teller, all of those sort of decreases in the amount of social interaction that older adults are experiencing on a day-to-day can really increase the risk of older adults experiencing abuse and mistreatment. There's also, to Tanisha's point she mentioned earlier, there's an increased financial strain and a heightened dependency where older adults are, having to rely on caregivers and on family members more and more, and those may be the folks that are harming them. And so we're absolutely seeing that, and we know based off of those data that there is more work to be done and there are more folks that we need to reach. And we really want to make sure that older adults who are experiencing abuse and mistreatment know that they are not alone, that there are services available, that what they're experiencing is not their fault, and that they can reach out and get support through folks like Neighborhood SHOPP and other providers we have across the 5 boroughs.
Yeah. Tanisha, how do you get, the word out, given the fact that sometimes we're talking about isolation, they're staying indoors, some family members may not be so privy. How are we doing the job of getting the word out that's so necessary and so vital?
So we've had this program since 1995. So we understand that we have to be the voice for that vulnerable senior. We are the platform to provide the support. And what we do is we tackle all of the older adult centers throughout our community. And again, going to even banks and looking at other professionals, hospital discharge planning. We have to really expand the platform that we do year to year. Just this year alone, we've had over 100 community outreach events spreading the word. And as I mentioned before, we're even this year targeting the faith-based community because it really does take a village as a community, and we have to be that voice in educating and empowering these seniors to speak up, being that it's so underreported.
Yeah.
We know that the elder abuse is happening, but it's not being reported. And we as a community should take the responsibility of looking at what those red flags are.
Well,
and know where to turn to for help.
Yeah, I was going to go right here on it because you talked about the red flags. How do we get to a place of understanding what those red flags are, particularly given the fact that I could be having someone right in front of me who's abused and not even know it because they're just going through the motions. Or I see somebody and I might misdiagnose or, misinterpret them just be having a bad attitude, but the reality is they're being abused.
Well, there are different signs to look out for, and some of them can be misinterpreted, right? There's a lot of cases where you may have an overwhelmed caregiver who is so stressed out and who may be yelling, and then there's a report that this senior is being abused, but yet you're dealing with an overwhelmed caregiver. But in regard to looking at the signs, I mean, looking at the body language of the individual, does this person have a bruise? Can they explain that bruise? And just in your engagement with the individual, how are they making the report? For us, it's also about how you relate to an individual, right? As an organization, we came up with an elder justice play that we actually show these videos to other seniors in the community, along with professionals, but it refers to what are the red flags, and it goes to different types of abuse to help in providing that education of how to detect it. Again, it can be misinterpreted, but it's very similar to a child being abused when unsure. Then, as long as you know where you can make the report, that I would say is the first step. The key is making sure that any senior you encounter is safe in the community.
Right. What are the biggest barriers, if you could, say when people are trying to get the help for being abused? What do you find to be some of the strongest barriers?
So the underreporting, I would go back to the individual going through fear, having fear, shame, and dependency. I would say cultural and language barriers. It creates a challenge because, again, we would need the individual. At SHOPP, we deal with individuals who have capacity to make decisions so that while we provide the supportive counseling, we're with you throughout that journey, right? We want to empower you to believe that you can be resilient. So you may come through our doors as being abused, but you're going to walk out our doors being a survivor, because we're going to walk through this journey with you. But the legal and ethical challenges as well. You may have a senior who has capacity to make decisions and is okay with how they're living. So we have to respect their self-determination, and that alone has been a great challenge for us. But a lot of the barriers, I would say, would be the cultural and language, and now even with immigration and just having the fear of reporting,
You,
having anyone come to my home.
yeah, I only have a minute left, but you tapped into my next question. I really was going to ask you. Talk to me a little bit about, and Molly, you can jump in here too. What are we seeing? And I only have about a minute and 30 seconds left. But tell me, what can you tell me about immigration and those who are aging in the immigration population? Are we seeing them come through the doors? Are they staying home for fear of what's going on with deportations?
We're finding that they're staying at home and not reporting the need for services. We've had calls, but then there is a fear of, I want to withdraw, this referral. And it's not even just on elder justice, it's just supportive senior services in general. We're finding that there really is a fear to accessing services.
All right, well, I got to leave it there. Molly, thank you so much for taking the time for being with us. Tynisha, thank you so much for being with us as well. It's been great to have this conversation. A very vulnerable population that we want to do our best to make sure that services get there. So thank you both for sharing with us.
Thanks.
Thank you.
All righty, we are taking a quick break, but guess what? We'll be back with more coming up right after this.